alignment training. In this short video, I'm going to go through self-cupping technique for the quadriceps. Okay, so for self-cupping for the quadriceps, you'll need a cupping kit, so a dry cupping kit. This kit is the handsole kit, which you can get from Physique. This comes with 10 cups, which is ideal for self-cupping, and a pump. You'll also need some massage medium. It doesn't really matter what type of medium that you use, whether it's wax, oil or lotion. Just for the purposes of this video, I'm using the lotion that you can get from Physique Management. Okay, so quadriceps. From here, what you need to do first of all is pop some lotion onto the tissue that you're going to cup. Okay, so try to make sure that the leg is in a relaxed position, so either on a couch if you've got a couch available, or you can do it on a chair as well. Okay, so a little bit more medium than you would apply normally if you're doing massage therapy. Then with one of your cups, you're going to put the cup into the bottom of the gun or the pump, and then pop the cup onto the tissue. So listen to the body. Normally between 1 to 2 pumps is enough, and the more cups you put onto the area, the stronger the suction effect is going to feel. So you want to cover most of the tissue. Okay, and again, each area might feel slightly different. You might get different colours coming up in the cups depending on which area of the muscle it's on. That's absolutely fine. If you see it coming up quite black, the colour mark coming up quite black really quickly, then reduce the intensity in that cup. Okay, so we've got the cups on. We can leave it static, that's absolutely fine, and leave it here for about 3 to 5 minutes, and you'll gradually feel a reducing effect, and by the time you get to sort of like 3 minutes, you probably won't be able to feel the cups anymore. Okay, another technique that we can do from here to get the stretch reflex kicking in a little bit quicker would be a variation of soft tissue release. So from here, you want to drop the leg to either the side of the couch or the side of your chair, and then from here you're going to gradually flex the knee, so this heel's coming in towards the bottom. Okay, then extend the knee again, and then you're going to flex the knee, and you will feel each time that you flex the limb that suction won't feel quite as strong, and you'll feel that stretch reflex kicking in a little bit more. Anywhere really from about 3 to 6 times is normally enough. If it hasn't fully relaxed after 6, you can keep going up to about 8 times. Okay, when you feel that tension in the quads group has relaxed a little bit, then from here you're going to bring the leg back up onto your couch or relax the leg again, and then you're going to take those cups off. Okay, so to release the cups, you're just going to pull at the top of that valve and pop the cup onto your couch. Okay, you can then from here flush towards the hip, so a little bit of effleurage, so you're flushing up towards the hip. This might be enough, and you might feel that the tension in the quadriceps has fully relaxed. Or we can then follow up with a sliding technique. Okay, so I'm not going to put as much suction into the cup now. I've put 1.5 in, and then from here I'm going to slide my cup up and down. I should only need to really have a soft grip on the cup for it to slide, and you can see the erythema already coming up on the muscle group. If you have to tug the cup to get it to move, then it's too tight, so take the cup off and then reduce the intensity. Okay, so sliding over the whole of that area, but again making sure you've got enough massage medium on there, because otherwise it will feel really uncomfortable. Okay, so sliding over the area, you'll feel the warmth coming in, you'll see the colour coming up as you've increased that localised blood flow, and then when you've finished, you're going to release the cup, pop that down, and then do a little bit of effleurage towards the hip joint to flush that area out. Okay, so that's self-cupping to the quadriceps. In this short video, we're going to go through self-cupping to the lower leg, focusing on anterior tibialis, gastrocnemius and soleus, and releasing that tension in the lower leg area. So if you've got a treatment couch, you can do this on your couch. Alternatively, 2 chairs will suffice, because you want to make sure that the muscle that you're focusing on and cupping is nice and relaxed. Okay, so you will need your cups from your cupping kit. This is the handsole kit, and you can get a 10-piece kit from Physique, which is ideal for self-cupping. You'll also need some medium. So here I'm using the lotion from Physique, but you can use oil or wax as well. Whichever medium you've normally got freely available at home will be absolutely fine. Within your kit, you'll need a selection of different sized cups and your pump as well. So you're going to put your lotion onto the area that we're going to cup. Okay, so using a little bit more lotion than you would do normally and covering all of the tissue area. Okay, so we're going to start off with static cupping, which is literally putting the cups on and leaving them. So you're going to put your cup into the bottom of the pump here, okay, and then we're going to pop it probably about so anywhere between 1.5 to 2.5 pumps into the cup. Okay, hold the cup down as you release the pump there, and then the cup will stay on the tissue. Because at first your cups and the pump can be a little bit tight. Okay, then from there, going down the tissue area. As we get nearer to the ankle, the muscle turns into that stronger tendon, so it will get a little bit tighter. So you might want to use a slightly smaller cup as you get nearer to towards that ankle joint. Make sure as well that again you are covering the whole of the bottom of the cup with the tissue. Okay, you could focus on the front of the limb, or you can do both sides at the same time. So we're now coming into the gastrocnemius. Okay, popping that cup in. You'll probably find the gastrocnemius in this position is a little bit more relaxed, so you might get more tissue suction into the pump, but you're listening to the body, making sure that you don't feel pain. You should feel that suction lift, but it shouldn't feel painful. And as you're putting the cups on as well, you're checking the colour of the tissue inside the cups, which is one of the reasons why the cups are see-through, so we can see what's happening to the tissue. Make sure that it's not going a dark purple blackish colour. You want to stay really sort of like a pinkish reddish colour, and make sure it's not painful as well. Okay, so keep monitoring the colour within the cups the whole time. So we could stay with this static cupping for anywhere between 2 to 5 minutes, and you'll feel after a couple of minutes that the stretch reflex has kicked in and the tension within the muscles has released. Okay, alternatively, we could do a little bit of active movement here as well. Okay, by dorsiflexing and plantar flexing at that ankle joint. Start off with a small movement, so lifting the toes up towards the shin and then relaxing that foot back down again. So we're lifting the toes and then pointing those toes back down. So dorsiflexion and plantar flexion. As you repeat those repetitions, doing a variation of soft tissue release here, as you actively move that joint, you'll feel that the joint can start to move further. Okay. If any cups come off as you're doing this action, then just re-pop them back on again. Okay, and then once you've repeated that anywhere between 3 to 6 times, you should feel the tension in the tissue release. Okay, then when you're ready, you're going to lift the valves at the top of the cups to take those cups off. Okay, and then from here, once you've taken those cups off, you're then going to flush towards the knee joint. So you're taking your hands on both sides of the limb here, and you're doing an upward flushing massage movement towards the knee joint, just to help to disperse any toxins there and to help with that blood flow. Excellent. And then once you've done one side, have a go on the other leg as well. Okay. Thank you. In this short video, we're going to focus on a self-cupping to the forearm. Okay, so the wrist flexors and the wrist extensors group. So as therapists, we're often the last person to get treatment, so this is the ideal time really to catch up on self-treatment. So you'll need a cupping kit. This is the handsole cupping kit that I've got here. And you can get a 10-piece cupping kit, which is ideal for a self-treatment from Physique. You'll also need some medium. So in this, I've got the lotion from Physique, but you can use whichever medium you normally have at home. So either wax, oil, or lotion. Okay, so you need a surface to rest the forearm on. Doesn't necessarily need to be a couch, it can be a table as well. And you're going to put your medium onto your forearm first, and you're going to use a little bit more medium than you would do normally if you were doing self-massage. Okay, so cover the whole of the area, and then from here you're going to get your pump out of your kit, and you're going to pop one of your cups into the bottom of the pump. Then from here you're going to pop the cup onto the forearm area. Now at first your kits can be a little bit stiff, so just be careful as you take the pump off the cup, making sure that you don't lift the cup off the tissue. Okay, so depending on how tight the forearm is feeling, how much tension you've got into the area, you might want to use 2 or 3 cups. As you get nearer to the wrist, the area gets smaller, and if you've got a smaller forearm, you'll need to use smaller cups. So as you get nearer to the wrist area, you definitely need to use one of your smaller cups from your kit. So again, popping that cup into bottom of the pump and lifting the tissue. So roughly anywhere between 1 to 2 pumps is normally sufficient. So you can leave the cups on statically here. That's absolutely fine, and you'll definitely feel after a minute or so the stretch reflex start to kick in as the muscle tissue relaxes. You can do both sides of the forearm at the same time by turning the arm to the side and then popping a couple of more static cups onto that wrist extensors group. If you feel that you want to have a little bit of a quicker release, from here what we can do is hang the hand off the area of your table or your couch, and you're just going to slowly, one of my cups has come off there, which is quite normal, but I can still got clear suction in those 2 other cups. So I'm flexing and extending at that wrist joint. And as I do that, that's increasing the stretch within the tissue, and you'll feel that relaxation effect kick in a little bit quicker. You'll also probably see the colour starting to come into the cups a little bit quicker as well. So you want to see a sort of a reddish pinkish colour. If it goes really dark purple to a blackish colour, then take the cup off quicker. But you're sort of looking, you're going on the look, so reddish pinkish colour, and also on how the cup feels and how the tissue feels. Once you've done that a few times, you should feel that relaxation effect kick in. And then from here, we can take those cups off, and then we're going to flush towards the elbow joint with a little bit of effleurage. Okay, so that might be enough, or we can then go into the sliding technique. So you might want to do static with your soft tissue release on your wrist flexors group, and then as you come onto that wrist extensors group, you might want to go into the sliding technique, or do both on both sides. So I'm going to demonstrate sliding here. So I need a smaller cup, because we want to try to get down nearer towards the wrist area. Okay, we don't put quite as much suction into the cup if we're going to slide. So probably about 1 to 1.5 pumps here. And then from there, I'm going to slide the cup up and down the surface area. So it might start off as a small slide at first, and then gradually as that tissue releases and the tension releases out of the tissue, then the slide might get slightly longer and longer. Okay, so start off with small slides and then gradually increase that sliding area. And then from here, you can also do the same on the other side. Okay. So again, about 1 pump here, and the cup should move relatively easily. If you've got to tug the cup, then it's on too tight. Okay, so if it's not moving and you've really got to force that move, then it's on too tight. So it should slide up and down the area relatively easily. Okay, and you'll get quite a lot of feedback from the cup itself as well on how much tension's into that surface area. Then release the cup again by lifting that valve at the top, and then from here you're going to do the effleurage and then flush down towards that elbow joint. Excellent, and then once you've done one of your arms, you're going to swap over and have a go on the other arm as well. Okay, thank you.